I'm Luis Paz-Ares. I'm a medical oncologist. I'm the chair of the Department of Medical Oncology at the 12th of Octubre University Hospital in Madrid. The EVOKE-01 phase 3 trial is a study that compared govitecan to docetaxel in patients with metastatic non-small cell lung cancer previously treated with platinum-based chemotherapy plus PD-L1 or PD-1 inhibitors. The trial had actually included some 603 patients with measurable disease, good PS, that had already progressed on platinum-based chemotherapy and PD-1 or PD-L1 containing regime. For those patients with actionable genomic aberration, they should also have received at least one approved TKI. And importantly, those patients with brain metastasis, if treated and stable, they would have been eligible. Patients, 603 actually, were randomized on a one-to-one basis to receive sacituzumab govitecan versus docetaxel at the standard doses of the two drugs. And the main endpoint of the trial was overall survival, and some other relevant secondary endpoints included here were concerning efficacy, safety and tolerability, but also quality of life. So the main endpoint of the trial, overall survival, was not met in this study. There was some numerical improvement with a hazard ratio of 0.84 in favor of govitecan. That was not statistically significant. Consistently, there was no difference in PFS or OS. I have to remark that sub-analysis of the trial previously planned suggested that those patients that did not respond to PD-1 or PD-L1 containing blockers regimes were actually benefiting more from govitecan as compared to those patients that had responded to PD-1 or PD-L1 containing regimes that did not respond, that did not benefit at all from govitecan. And indeed, even the number of patients with actionable genomic aberration was very small, 44 patients. Those patients maybe also derive a greater benefit as compared to the patients without actionable genomic aberrations. In terms of safety, I would say that govitecan was somehow a bit better tolerated, with less patients requiring treatment discontinuation, 10% as compared to 17%. And also, there were some improvements in quality of life for those patients as compared to those treated with docetaxel. So altogether, I would say govitecan had shown to be active and well tolerated in patients previously treated with metastatic non-small cell lung cancer. And indeed, the drug is being evaluated in combination with immunotherapy in the first-line setting. Indeed, the EVOKE-02 trial, whose data, interim data had already been presented, and there is a phase 3 trial, the EVOKE-03 trial, which is actually ongoing. So I would say that it's important, we have seen with the TROP2 directed ADCs that there are activity. However, we are not totally clear who are the patients that are benefiting the most. We are not sure what if every single agent is similar to the other. Data suggests that they are not similarly in terms of efficacy. The toxicity profile is also somehow different. And it would be nice to have a clear predictive factor for those agents. We are expecting many other ADCs to be developed in lung cancer. So it would be nice at the end of the day to have specific factors that help us to decide which patient is going to benefit from each specific ADC and which patient is not going to benefit at all from a given drug. So I think this is something we have to work very much into the near future.